This is KGW News at noon.
What he's doing is late, too late, anemic. Hopefully we can make up for the loss of time.
That's House Speaker Nancy Pelosi slamming President Trump this morning. She's part of a growing number of Democratic lawmakers claiming he's not doing enough to protect against the spread of the coronavirus in the United States. The CDC now warns the virus could soon become a pandemic. Thank you for joining us. I'm Brenda Braxton. This afternoon, President Trump will hold a press conference on the outbreak alongside representatives from the CDC. That will happen at 3 o'clock. In the meantime, the White House is asking for an additional $2.5 billion from Congress to fight the virus. More than $100 million has already been spent. This morning, testifying before Congress, the Health and Human Services Secretary laid out a case for more money.
The budget reflects how seriously we take the threat of other infectious diseases, such as the novel coronavirus, by prioritizing funding for CDC's infectious disease programs and maintaining investments in hospital preparedness.
But Democratic lawmakers argue the Trump administration isn't taking the outbreak seriously, and they're pushing for even more funding to fight the outbreak. Today, New York Senator Chuck Schumer asked for $8.5 billion to fight coronavirus. That's more than triple the president's request. Well, today, the CDC confirms 2 new cases of the virus here in the States, bringing the total number to 59. There are none in Oregon, but there is 1 confirmed case in Washington. Christine Pitawanich has a closer look at those numbers.
We want to start off with a tweet from the CDC. First, though, you may have seen COVID-19 appear whenever the coronavirus comes up. It's a CDC classification, and it stands for Coronavirus Disease 2019. So this tweet is from the CDC, and it says there are currently very few cases of COVID-19 in the U.S., but as more countries see community spread, successful containment, they say, becomes harder. And the CDC says it is preparing for community spread in the United States. As for the numbers, this is where we stand right now. Globally, there are more than 80,000 confirmed cases. What that looks like on a world map is this. All these red areas show where the coronavirus has been found. Most recently, Brazil has been added to the list, and more countries could follow suit really at any time. And there are people who are being monitored because they've had close contact with someone who has the virus. There are 76 people in Oregon and 384 people in Washington, again, being monitored. So the big question is, would we be prepared if it spread here? The CDC is now advising employers and schools to plan and start thinking about the possible widespread disruptions that could happen, like limiting travel and large meetings, allowing workers to telework, or closing schools, or allowing internet schoolwork. Yeah, some of this is a little bit scary to talk about, but with all that said, it is also important to remember that the CDC is still emphasizing that the immediate health risk to the general public in the U.S. is relatively low. As for a vaccine, there is none yet. The National Institutes of Health say trials could start within a couple months, but it would probably be another year at least before it's widely available. In the studio, Christine Pitawanich, KGW News.
And we have much more coverage of the coronavirus on KGW.com and our news app. We also want to know what questions you have about coronavirus. Send a text to the number on your screen, 503-226-5111, and we'll work to get you answers. You can also post your questions on our Facebook page.
I'm really disappointed, not just for the athletes, but for the volunteers, families.
That woman in Southern Oregon says she's frustrated. Janine Nielsen's son has Down syndrome and competes in Special Olympics, but he's one of the many athletes who won't be taking part in the state games. The CEO of Special Olympics Oregon has canceled the 2020 state games for the 3rd year in a row. The CEO tells us in the last 2 years, they've reduced their debt from $2.5 million to $246,000. There's still a long way to go, though, but the CEO does hope to bring back the state games in the next year or two. Turning now to weather, we want to check out the view from our Rose City Skycam. Yep, I see a tiny bit of blue, but mostly gray clouds. Chris McGinnis has more on the forecast. It's cloudy here in Portland, but sunny on the coast.
It's trying to clear out. It's taken a little while, as we thought it might, but it is starting to break up. In fact, at the beach, it's been sunny for much of the morning now. This is a live look from Yaquina Bay, and it's gorgeous right now along the Central Oregon coast. A look back at a snow-capped Mount Hood from the Dalles, Oregon's Veterans Home in the Dalles. That's where this camera is located, so it's pointed west. And you can see we are clear as a bell on the east side of the gorge as well, so we're getting a nice look at the Cascades. And last but not least, in the valley, we're trying to clear things out just a little bit. In fact, as we bring up our Stoller camera, I'm going to slide off here and see if I can get that to advance for us for a second. No, we will go over to the reserve, and you can see that the cloud cover there is still kind of hanging tough, but that will improve a little bit as we roll through the afternoon. Visible satellite imagery showing the cloud cover starting to erode ever so slightly up and down the I-5 corridor, and that trend will continue over the next couple of hours. We are mild-ish, 51 last check at the airport and in Vancouver. Mind you, our normal high this time of the year is about 53 or 54, so we're already just about there and warming. 50 in Tigard, and it's 55 now in Salem with some sun breaks in our state capital. All right, the plan for the rest of the afternoon, cloud cover thinning out, and daytime highs getting up to about 55, maybe 56, and then we cool it back down again. Sunset this evening, 5:53. We are warming it up even more as we head into the end of the work week. I've got that part of your forecast in just a few minutes. Brenda?
We'll see you then. Thank you, Chris.
Anybody in this room imagine moderate Republicans going over and voting for him?
The last 50 polls that have been done nationally, Mr. Bloomberg, I beat Trump 47 of those 50 times.
Bernie Sanders took the brunt of attacks in last night's Democratic debate. He's the front runner now, and the other candidates took shots at his proposals like Medicare for all. The 2-hour debate was in South Carolina, home of the next primary on Saturday. Our Verify team watched closely to fact-check the candidates' claims. Here's Jason Puckett.
Debates are key events through primary season, so we're constantly checking to see if the candidates are telling the truth or lies. Right now, we're breaking down claims from the two candidates who've earned the most delegates so far. Up first with 45 delegates, Bernie Sanders.
You know what? For the ordinary American, things are not so good. Last year, real wage increases for the average worker were less than 1%. Half of our people are living paycheck to paycheck.
These claims are true. He talked about real wages. That's just wages that have been adjusted for inflation. Now, Bureau of Labor Statistics data showed that from January 2019 to January 2020, real wages increased by 0.6%. And two recent surveys, including this one from Charles Schwab, found between 49 and 59% of Americans are living paycheck to paycheck. Both claims true. Next up with 25 delegates, Pete Buttigieg.
What is a radical idea is completely eliminating all private insurance. And part of how you know it is that no industrialized country has gone that far.
The claim that no industrial country has completely eliminated private insurance is true. A database by the Commonwealth Fund breaks down other countries' healthcare systems. It's dense. Two main points. One, most industrial countries have some form of universal healthcare. And two, none of those countries completely eliminated private healthcare. Yes, they have some form of central government system, but private healthcare still exists to supplement or complement those programs. Sanders and Buttigieg currently have double-digit delegate leads, but the other five candidates also had plenty to say at the debate. We've got a thorough breakdown of all the candidates' claims up on our website. And if you see anything else you want us to check out, send us an email. With your Verify, I'm Jason Puckett.
If you haven't registered to vote yet, pull out your phones. You can text the word register to 503-226-5111 and we'll send you a link with everything you need to know. If you're planning to vote in Washington, you need to be registered by next Monday. For Oregon's primary, you have until April 28th. In Salem, the Republican walkout over cap and trade entered its third straight day with no end in sight. Republicans in both the Oregon House and Senate didn't show up to their morning meetings. There's about 2 weeks left in the session, and right now almost everything is on hold. Senate President Peter Courtney highlighted one of the bills on hold. It's House Bill 4073. It would put a cap on rising insulin prices.
The Senate could begin its work on bills that protect users of insulin from prices that are so high they can't afford it. That bill came out of the House 47-8. We had major bills on insulin last session.
Yesterday, people rallied on the Capitol steps, calling on lawmakers to get back to work. Cap and trade would lower greenhouse gas emissions by making companies buy carbon credits if they're big polluters.